Good afternoon, guys. This afternoon's topic A discusses how most Americans underestimate the cost of long-term care. So that's what we're going to discuss this afternoon for A. So please join me in this afternoon's discussion. Okay. The article discusses how most Americans underestimate the cost of long-term care for themselves or loved ones when they can no longer manage daily tasks independently. According to a study by the Employee Benefit Research Institute, 8 out of 10 U.S. workers expecting to provide long-term care in the future estimate costs under $1,000 per year. Within 60% estimating less than $50,000. However, research from the U.S. Department of Health and Human Services, HHS, shows the actual cost is around $121,000 for just under a year of care. Additionally, HHS research indicates that 56% of older adults or older Americans will need long-term care for an average of 3.1 years. Most of this care for average of 1.3 years. Most of this care is unpaid, provided by family or friends. Give me 1 second, guys. With typical costs accumulating over a nearly 10-month period, when paid services are required, the EBRI survey conducted in late 2024 with responses from nearly 2,500 U.S. workers highlights the lack of preparedness among Americans for long-term care expenses. Long-term care costs in the U.S. tend to be higher than many other developed countries, largely due to the lack of universal coverage and reliance on private insurance or out-of-pocket payments. Here's how the U.S. compares to other nations. Japan, long-term care insurance is mandatory for citizens aged 40 and older, with half funding coming from tax revenues and half from premiums. Older adults contribute 10% to 30% of service costs based on income, with insurance covering the rest. Japan spent 67% more on long-term care as a percentage of GDP than the U.S. in 2020. The Netherlands, the Dutch system includes long-term care in universal health coverage. Taxpayers contribute nearly 10% of their income toward insurance premiums, and out-of-pocket payments make up about 7% of institutional care costs. The Netherlands spent 4.1 of its GDP on long-term care in 2021, 4 times what the U.S. spent. Canada, provinces and territories fund long-term care through general tax revenue, but funding varies, leading to wait times and out-of-pocket expenses. Private reimbursement, private retirement homes can cost up to $5,000 per year, with additional fees for service like bathing or doctor visits. Overall, many countries provide more government support for long-term care, reducing individual financial burdens. Compared to the U.S., where costs often fall on families or private insurance. Let me know if you'd like more details. Higher long-term care costs in the U.S. have several far-reaching implications. Okay, number one, financial strain on families. Since much of long-term care is privately funded, families often struggle to cover costs, sometimes depleting savings or retirement funds. Many caregivers also face lost income if they reduce work hours to provide unpaid care. Increased reliance on government programs. Medicaid covers some long-term care expenses, but eligibility requires that exhausting personal assets. This places a significant financial burden on state and federal budgets. Limited access to care. Many older Americans may forego necessary long-term care due to cost concerns, leading to unmet health needs and potentially worsening medical conditions. Growing demand for policy changes. As costs rise, there is increasing pressure on policymakers to reform the long-term care system, whether by expanding coverage, creating new funding sources, or conventionalizing private insurance options. Okay, impact on workforce and economy. Most people leaving jobs or cutting work hours to provide unpaid care can result in lower workforce lower workforce productivity and economic consequences. Would you like to explore potential solutions for long-term care affordability? The U.S. long-term care system differs significantly from those in other developed countries, primarily due to its reliance on private funding and Medicaid for low income individuals. Here's how it compares. Japan, long term care insurance is mandatory for citizens over age 40 and older, funded through tax revenues and premiums. Older adults contribute 10% to 30% of service costs based on income. Okay, folks. With insurance covering the rest, Japan spent 67% more on long term care as a percentage of GDP than the US in 2020. The Netherlands, the Dutch system, includes long term care in universal health coverage. Taxpayers contribute nearly 10% of their income toward insurance premiums and out of pocket payments to make up about 7% of institutional care costs. The Netherlands spent 4.1% of its GDP long-term care in 2021, 4 times what the US spent. Give me 1 second, guys. Seems like it's this part. I can do the rest of the presentation for you. $5,000 per month with additional fees for services like bathing, doctor visits. Overall, many countries provide more government support for long-term care, reducing individual financial burden compared to the US, where costs often fall on families to provide ensures. Let me know if you'd like more details. The U.S. could adopt several improvements from other countries to enhance its long-term care system. Universal long-term care insurance. Countries like Germany and Japan have mandatory long-term care insurance funded through payroll taxes, ensuring broader coverage and reducing financial strain on families. Okay, then you've got government-funded home care. The Netherlands provides extensive home care for their folks. Let me get another. Care services through public funding, allowing older adults to receive care in familiar environments rather than institutional settings. Paid family leave for caregivers. Many European nations offer paid leave for family caregivers, reducing economic hardship for those who need care for loved ones. Then you've got standardized national funding. Unlike the U.S., where long-term care funding varies by state, Canada uses general tax revenue to fund services, ensuring more consistent access. Social insurance models. Countries like Germany automatically enroll citizens in long-term care insurance as part of their health coverage. Financed through employer and employee contributions. Implementing these strategies could help reduce costs, improve access to, and ease the burden on families. Would you like to explore specific policy proposals? Okay, folks, so that is today's show for Sunday. I'll be back on Monday sometime for shows. I will see everybody tomorrow. For now, Gator Wellness, take care, folks.